Although most studies report a decline in sexual desire and interest with aging, maintaining healthy sexual interests well into the 80s and 90s is not uncommon. Evidence suggesting that men and women remain sexually active to their later years refutes the myths surrounding aging and sexual dysfunction. Age-related physiological changes do not challenge the possibility of meaningful sexual relationships. Some sources suggest that 95% of men aged 46 to 50 years and 28% of men aged 66 to 71 years have intercourse on a weekly basis. 74% of married men older than 60 and 63% of men aged between 80 and 102 years remain sexually active. For men, greater physical stimulation is required to attain and maintain required erections, which makes sexual activity more tiring than normal, hence a decline in interest and activity. There's little change in sexual activity throughout the life course for men and women. Approximately 56% of married women older than 60, compared with 75% of married men, are sexually active, as are approximately 30% of women aged 80 to 102 years, compared with 63% of men. Other sources suggest that 68% of women aged 39 to 50 engage in sexual activity at least once a week, as do 65% of women aged 51 to 64 and 74% of women older than 65. Around 10% of women report an increase in sexual desire after menopause. In women, menopause terminates fertility, resulting in changes associated with estrogen deficiency. The estimates on men and women being sexually active could be higher but for the fact that sexual activity is determined purely based on intercourse, ignoring acts such as masturbation, sexual fantasies, caressing, and touching. As with men, masturbation frequency declines with age among women to around half of those aged 60. By age 80, there's approximately 39 men for every 100, which could explain the decline in sexual activity being greater for women than for men.